Okay. Ha, now it does. Mhm.
and then when we get back, I'll do the bath with them and then sleep.
You've got 6 minutes.
Enjoy.
That is somebody.
Try to get some toilet paper.
I looked on Amazon.
Yeah, I thought I'd run the same. Nobody wants it.
I doubt they have any.
That's it. Okay. See you later.
All right, Ben. Take sanitizer.
I think Nina's gonna stay here.
All right, take sanitizer.
Yep. Okay.
All right, so it is 10:30, so we'll go ahead and start. I want to thank everyone for attending this webinar. And I'm going to just introduce Dr. Kimberly Benton. She is a licensed psychologist and a certified eating disorder specialist. And she has experience with RCCs. She while she was in her undergrad, worked at Orange County Rape Crisis Center, and she now works with Oak City Psychology. So I'm going to go ahead and hand it over to her.
Thanks, Gabriella. Welcome, everyone. I can only see Gabriella on my screenshot, so I will do my best once we get to the Q&A to be able to answer everybody's questions. I will also email Gabriella handouts for these slides in case you need them for anything. And my email address is also at the end. So if you would like to get in contact with me to ask further questions, or if you have any clarification that you need, or would like a copy of the slides or anything like that, feel free to be in touch that way also. So this webinar, Monica asked me to do this for everyone around kind of the changing times that we are living in and using more telehealth, especially video options. And so I've kind of started with the very basics here with the hopes that it will kind of get everybody onto the same level. And then if you have any more in-depth questions, we can go over those at the end. So first thing that I want everyone to do, though, is to breathe. So one of the things that can be really helpful when we're doing this work is to be able to take the time in between sessions to ground ourselves, to kind of bring ourselves back to the moment, to stretch some. So actually getting up from the spot that you're sitting in. And I just want us to take a moment here as a group to take a nice deep inhale through our noses and out of our mouths. And just to notice how that helps our body calm. It helps our shoulders relax. You know, if you're sitting at your desk, you can even reach your arms up over your head for a little bit of a stretch there. You can bring them down back to your lap, roll your neck out. Just to kind of get yourself into a nice, grounded, comfortable space. So as Gabriella mentioned, I am Dr. Kim Benton. Kim or Dr. Benton is fine. Whichever you're most comfortable with. I'm a licensed psychologist in the state of North Carolina, and I have been a licensed psychologist in the state of Georgia also. We lived there for 13 years while I went to grad school. I'm also a certified eating disorder specialist. And in the fall of 1999, I began volunteering at the Orange County Rape Crisis Center in Chapel Hill. It was the defining moment in my career path, just seeing all of the amazing work that was going on there and all of the ways that as rape crisis centers, we were supporting so many people. And it really set me up for the work that I do today. Although I am an eating disorder specialist, I see people who are suffering with trauma all the time. And all of my work at the Rape Crisis Center really allows me to do that, I think, from a better place than a lot of my colleagues, especially during my graduate school years, because they didn't know what was going on in those areas. I also wanted to just bring attention to some of the potential bias that I may have. I don't know how that might affect this presentation, but I just wanted to point out some things about myself that I know give me quite a bit of privilege. I am white, I am female, not so much privilege with that often, but sometimes, especially in the field of psychology. I'm upper middle class. I have a high level of education. I am a cis het person. I have job security, basically because I own my own business. And so I can keep myself employed if I want to. I have a stable marriage and home life. I'm neurotypical and I'm Southern in the South, which gives me some privilege here, but maybe not always elsewhere. So in talking about doing telehealth work, there are some considerations that we're going to use for all clients, which you can see on the left side of the slide here. And those are, when you're providing these services, you want to be sure that you have a quiet, private space. And depending on the level of confidentiality that you're held to, you'll want to take even more precautions, such as locking the door to the office that you're in, being in a space where nobody else is around to potentially hear you, setting up noisemakers, all of those types of things. You also want to be sure that the client can have that space on their end. If their kids are going to be running around or their partner is going to be in the house, especially for relationship violence, which we'll talk about in just a minute, or if the environment that they're in is just hectic for whatever reason that is, this may not be a great option for them. And as difficult as it is, it may be better for them to just pause their services for a time than to continue to try to be in that environment and feel stressed about receiving the service. You also want to make sure that your client has access to appropriate technology. A lot of these programs now that we can use for the video conferencing have phone and device apps. However, oftentimes the technology is going to work much better if that person can be on a computer that's attached to at least Wi-Fi, if not fully grounded with a wired internet attachment. And that's basically just going to take away some of the frustrations that can go along with this, which is the next item on the list, which is your client's frustration tolerance. Especially in this period of time, everyone is trying to use these platforms. They are so inundated with all of the therapists using it, all of the medical professionals using it, all of the folks who used to work in an office but are now working from home using it. And so they can be very glitchy. It can disconnect often, depending on the client's access to that appropriate technology. It may be very difficult to connect. The sound could be bad, the picture could be bad, and your client really needs to be able to tolerate the level of frustration that can potentially come with this. You also want to look into any ethical and legal concerns specific to the service that you're providing. So for me, I have to do my job on my end to protect my client's confidentiality and still try to remain HIPAA compliant because I am a licensed psychologist. Depending on what your credentials are specifically, and also the credentials in the licensing that your Rape Crisis Center has gone through in their county and the state, you may have different levels of legal and ethical obligations, and those different levels could transfer onto the client in some way. And so you want to be sure that you've really looked into any of the ethical and legal concerns that are specific to the service that you're providing at that time. Especially when we're talking about the idea of maybe trying to do support groups online or those types of things, when we can't all be in the same space, to know that everyone's space is quiet and private, preferably confidential, that there aren't people kind of lurking in the background where you can't see them, and all of those kinds of things. The other thing to consider for any client is any language or cultural barrier related to video. Especially if someone's using their second language, they're going to be kind of responding a lot to your nonverbal cues. And so the idea that they may not be able to understand exactly what's going on, because as you can see, I'm waving my hands down here and you can't see that. So you may not know if I'm emphasizing something or those types of things. Also, when we're looking at people who are maybe depressed or anxious, being able to read body language can be something that's very important to them. And we'll talk about that specific to trauma in just a minute. But they may feel very uncomfortable with the idea that they can't fully see your body as you're doing this. And so they can't understand exactly what you're saying. Another issue for those of you who may work with the hearing impaired is that you may notice it's much harder to read lips on this kind of a platform. And therefore, it can make it very difficult for people who are hearing impaired and relying on lip reading to be able to really participate in any kind of service in this manner. So those are all things to kind of think about, regardless of who the client is. And when we start talking about special considerations for clients at rape crisis centers, there are kind of even more issues that come into play there. So one of the issues is that oftentimes you may be dealing with people who are in relationship or domestic violence situations. And especially if they're trying to do some of this work from home with you, then it's possible that the person who is abusing them is in the room, in the house, somewhere nearby. And so what you will want to do with that person is to create some sort of code word, almost like a passcode that they use at the beginning of session to let you know that it's safe for them to be able to speak. I would recommend that you also do this if you have consistent contact with someone who may be using some sort of a text or messaging service, emails, voicemails, those types of things, so that you know that this person is calling you and is relaying actual genuine information from them and not information that their abuser is kind of forcing them to share with you. And that code word can really be anything. Like it could be asparagus. It doesn't really matter. I have my clients, when they use these platforms, to type in a password. And it doesn't have anything to do with anything. It's just a random word that I picked that I liked, that I thought would be easy for my clients to remember. And that's how I know that they have chosen of their own free will to engage in this session, and that I'm really getting information from them, not a partner, not even a parent. Sometimes when I'm working with teens, parents like to try to be sneaky sometimes with their information and contact. So keeping that in mind, especially with the population that you're working with. The other thing to really consider is with trauma folks is the role of video in their trauma, especially as we're moving into more of an age where that video, especially webcams, can really be used as part of the abuse. And so doing this kind of work for some clients who have had that experience may not be the best option for them. You may want to talk to them about speaking on the phone or using some other form of communication if you really want to be able to see them, that's not going to be as triggering for them. Another issue specific to folks who have experienced trauma is the perception of other people that they have based on their trauma experience. So again, being able to read body language, that this face that I just made, which indicates that I'm thinking right now, for someone who's experienced trauma, it could indicate anger. Also, if they can see that something's moving, like my shoulders are right now, but they can't see my hand, they may not understand that I'm not masturbating while I'm talking to them, because that would be something that people that they've interacted with may have done to them in the past. And so it becomes very important for you to become very aware of your own body language and how you are sitting and being in the space, so that you're conveying the appropriate information to your client. And being open with your client to be able to say, if I'm doing something and you're worried about what I'm doing or you have questions, please ask me so that I can clarify, because I recognize that this modality of treatment may not be great. And then I would encourage you to think of other ideas for things specific to maybe some of the folks that you're working with or in your environment that may continue to be an issue based on using these telehealth and video health services. So if you're using these video services, which is what I'm going to focus on for this remainder of the training, there are some things that you're going to want to do before you start doing sessions. If you've already started doing these video sessions, then you want to kind of backtrack a little bit and put some of these protocols into place. So you may need to relook at your emergency protocols that you have. I know almost every rape crisis center already has these protocols in place because they may be using some form of a crisis line already. What you want to do is you want to go back into those protocols and make sure that they cover video sessions, that they cover distance, that they cover being across state lines, across county lines, all of those types of things, especially when you're doing video, because you will actually be able to see what's going on. You also want to be sure that your protocol covers things that you might be able to see that your client isn't reporting to you. So if there are concerns about neglect in the home for a child abuse situation or things like that, and you can actually see the space now, although your client maybe has been telling you that that's not happening and that maybe they're trying to cover for the person who's creating this environment, now that you've seen it, your duty is going to be to report. So you want to be able to have those protocols in place so that everyone at your center knows what they're doing, and that you've explained these protocols to your clients. It's important for them when they're consenting to get these services, and they know what they're consenting to. You also want to go through and have a plan for any technology failures that might happen. You want to create kind of like a flow chart of troubleshooting steps. So for me, I actually have 2 different platforms that I can use that are HIPAA compliant for my sessions with my clients. I have one that I prefer, and then I have a backup. Honestly, the backup right now is worse than the one that I prefer, so it works out totally fine. And then I have other steps to follow from that. So if the sound on my video is really bad, then what I can do is I can call from my phone, and we can use my phone for audio, and we can use the video platform to be able to see each other. I have some clients who do not want to be on video, and so we're doing phone sessions anyway. That's not necessarily a technology failure, but it's kind of in that flow chart. So you want to kind of look at all of the things that you have available to you and decide which ones are okay to use, and at which point you're going to have to say to that client, you know, technology is just not working for us. We're going to need to reassess and maybe come back to this at a later time. The other thing that you want to do is that if this is someone that you would typically be seeing in person, before you start your session with them at all, you need to know where they physically are, so that if need be, you can institute that emergency protocol that you've already created with your crisis center. And that way, if there is an emergency, or if they're threatening suicide or self-harm or those kinds of things, and you need to get emergency help to them, you know where to send that help. Some of these platforms have a texting or a messaging option embedded in them. And when I was using a platform that had that, where the client signed in, part of their sign-in process was to enter their address of where they were physically at that point in time. What that also tells me is whether or not they're going to be in a place that's private enough for us to really do a session. So if this client is maybe out at a park somewhere, which hopefully not, hopefully they're just at home. But if they happen to be out at a park somewhere and you can see there are a lot of people around, you may be tailoring what you're speaking to them about a little bit more, or you may be deciding that this is not the appropriate time to have this conversation with them and rescheduling that talk. So those things are things for you to think about and be aware of, but in order to really make those informed decisions for yourself, you really want to know where the client is, and that's at the beginning of the session. So in talking about these HIPAA compliant platforms, I wanted to provide you with the ones that are considered to be HIPAA compliant. This list came straight from the ORC's website. And so when we're talking about compliance with HIPAA, if that's something that you need to do based on either things that your center have decided or your own credentialing, these are the HIPAA compliant platforms. If it's not on this list and you're curious if your platform is HIPAA compliant or not, what you want to do is ask them for a business associates agreement or a BAA. And in that agreement, it will tell you whether or not the platform takes responsibility for encryption to the specific level that's required for HIPAA. The platforms that do not offer BAAs often means that they're not going to be compliant. So if you ask for it and they won't even give you one, that will be a clue. If they will give you one and they're not on this list, you're going to have to read that agreement fairly closely to make sure that they're taking the proper steps. And you can find that information on the website for HIPAA that will explain what those agreements need to have in them. Recently, there have been some exceptions made to this list, and that is because of the current pandemic situation that we're in. So as of right now, they will not come after you for a HIPAA violation if you use FaceTime, Facebook Messenger, video chat, Google Hangouts, this version of Zoom, or the free version of Skype. So you'll notice that if you look at this list and then look at this list, that some of the same companies are offering the services such as Skype and Zoom and Google. However, they have these kind of free options. Things that are absolutely 100% not acceptable for client-facing services from a HIPAA perspective are Facebook Live, Instagram TV, Instagram Live. Some things on Twitter I think can be live, Snapchat. Text messaging is still considered to not be HIPAA compliant. And so those types of things are some things that you may want to talk to your center about. If you're wanting to be able to use those tools, how can you do it in a way that is compliant to the level that you need to be compliant? And again, my guess would be that that's going to vary from center to center, depending on the services that you're offering, but also depending on who's providing those services and what your own credentials are as you're providing those services. So those are all going to be things to think about as you're moving through this process. So when you're thinking about setting up your space for this, I'm sure you will notice that I am in my bedroom. I don't have a home office for me. My husband actually works from home, so he does have a home office, but that's not going to provide a confidential setting for me to be able to do my sessions in. And so I've had to improvise a little bit. But some of the things that you want to think about when you're doing this are camera angle and lighting in your room. If I'm going to move my computer here, so I apologize if it makes anybody seasick. If I were to be doing sessions like this is a really bad angle. For one, if I need to blow my nose, I'm in trouble. But also, it makes it look like I'm looking down on the client. Even from this level, it's better, but it's not the best. And so if you're able to, I'll actually show you. I have a stack of books on my table that I've placed my computer on. in order to give it a slightly better angle. You also want to kind of be aware of lighting, because if I were to pull this desk light a little bit too close, that's going to light up one side of my face and make it look a little bit weird. The goal is to try to make it look as natural as possible so that you're not looking freakish to your clients. The other thing is actually where to look on your computer as you're doing this. And you'll probably notice I'm pretty terrible at this, honestly, and I warn my clients about that, because really where I should be looking is straight into my webcam. That's going to give my client the most feeling that I'm making eye contact with them. However, if my client is actually on the screen, I tend to look at their eyes because I'm trying to make eye contact with them. I also often will get distracted by my own image. And a lot of times when I'm working with clients, I'm often doing some form of a handcraft myself to keep my hands low in my lap and busy, so that I'm not fidgeting and wanting to check all of the notifications, and so that I'm not talking like this and making everybody seasick because my hands are all over the place. And so I'm really doing things, and I let clients know this. I'm not doing this, and not listening to them. It actually helps me listen, but also it's to keep things more calm on my end, so it feels more like we're in person. The other thing to think about is what's in your background. So you want to kind of check your surroundings. You will notice that I actually made my bed, which is not something that I typically do at all, if ever. But I've done it as I've been doing these video sessions, simply because it feels a little bit weird for my clients to be looking at my unmade bed. You also want to think about whether or not the wall behind you is completely blank. For some folks who have issues with dissociation, a blank wall can be very difficult for them to look at behind you in your background. So if you are having to use the blank wall, you may want to pull your camera a little bit closer to you so that the space behind your face is smaller, and potentially not as distracting for folks. The other thing that you want to think about is your own comfort. So how long are you going to be able to sit still in the space that you've created? Is the temperature comfortable? Is your seating arrangement comfortable? Are you able to sit without constantly shifting positions and moving around? Because in these videos, especially with so many people using them, all of that movement can be highly distracting for folks. So I actually have a blanket. I also have some pillows behind me. Oh, I think I have a question. Hang on a second. Yes, this person says that maybe a bedroom or looking at a bed can be traumatic, but so can any location. And that is accurate. And those things can be pretty uncomfortable for folks. So again, thinking about that background, checking your surroundings. Back to kind of the comfort piece of how long can you sit still in this space. You may also want to invest in a footstool, something that you can prop your feet up on, making sure that your desk area is a comfortable space for you, all of those kinds of things. So just being aware of what's going on around you and where things are. I think I have covered those. So when you're working with a client, it actually is a little bit different from doing in-person work. Part of that is because your energy is not in the room to help calm the client's energy. One of the things that we know about trauma work is that part of the reason that it works is because the therapist's energy or the counselor's energy and hormones kind of calm and ping off of our clients' hormones. Release of certain hormones in a space that feels safe with a person who feels safe can help make those adjustments. And so part of what is missing in this environment of not being in the same space is that so far the research has not shown that doing video work will give those same hormonal changes. So you're losing some of that in this space. Some of the other things that you're losing may be the ability to sit next to your client if they're comfortable with that and have asked for it to help ground them. I do have a couple of clients who like for me to sit next to them at times if they're talking about trauma, simply because having that safe person nearby allows them to feel like they can talk through things. I have one client who prefers that I hold her hand. Part of that is because of the type of trauma that we're working on when those things happen. And some of that is a therapeutic issue around transference. And so I know that some of those things cannot happen if I'm doing video sessions. Another thing that is not as easy to have happen when you're doing video session is to really take control of grounding techniques. So if I'm working on grounding techniques with a client and I'm trying to get them to notice things that they smell, I may bring out an essential oil that has peppermint in it, that has that strong smell in it, or Altoid mints or something along those lines, and put it near the client and ask them to focus on that. And if I'm not in the same room with them, then I can't do that. Or at times I may hand them something that they can rub between their hands or between their fingers. And if I'm not in the room with the client, then I can't do that with them. So you have to kind of rethink some of the techniques that you're going to be doing with folks. It's also interesting to try to create that feeling of safety. And so doing some grounding techniques with your clients around breathing, coming into their body, settling themselves where they are in their space is important. You may want to do a virtual tour of your current space with your clients. Some of my clients feel much more comfortable with that. All of my clients know that I have dogs, and so oftentimes now that I'm home, they want to see if my dogs can come into session. Yes, so Maria is also saying that letting them know that some quiet or nonverbal time during session is normal, and that to pause may seem longer on video than in person, and that is very accurate. Those types of things can seem much more uncomfortable in video as you're both sitting there. Other things that you may want to do for the client is to bring some familiar objects from the space where you normally meet with them. So if you have been able to bring anything from your space where you're seeing clients to your home, it may benefit you and the client to have those things around because those are things that they're used to seeing anyway. You may also need to change the techniques that you're using with clients. And I know you're all doing some form of trauma work because you work for a rape crisis center. But you're going to want to be really careful about allowing the client to get too deep into that trauma and instigating some flashbacks for them, especially if they're in a space at home alone where they don't have the ability to really calm themselves or connect with someone who can help them calm. So you're going to want to be very careful around all of that trauma work now that you're not with them. And you're going to want to shift your focus to things that they can do from home. So you want to be talking to them about how they're coping with being at home, how they're dealing with their surroundings, what can they do to make their home space more comfortable. I know a lot of your clients' home probably is not very safe or doesn't feel safe based on trauma memories or flashbacks. And so really working with them on creating that sense of safety where they're stuck for right now is going to be very important. The other thing that you're going to spend a lot of time doing with them is working on coping skills. We all know that a lot of times people who have experienced trauma get a very trapped feeling when they feel like they don't have control over what they can and can't do. And so allowing them the time to process through that feeling with you, but also helping them to create coping skills for themselves. So talking to them about breathing techniques, which can be completely as simple as what we did at the beginning of our time together today, of taking nice deep breath in through the nose, releasing it through the mouth, and just doing that with them a couple of times can be enough for some people. You can also do square breathing with them, which is a great technique. And it's called square breathing because you do it in counts of 4. And so you inhale for 4 counts, you hold that breath for 4 counts, you exhale for 4 counts, and you hold the exhale for 4 counts. So it's a 16 count process. It takes 16 seconds. Your client can do it more than once if they would like to, but they don't have to. So that's square breathing. Again, very simple, something that, you know, we can all benefit from. And I actually find myself doing quite a bit now. Another breathing technique that can be really calming for people is to take a nice deep inhale. And when they exhale, just say 1. If 1 is triggering for them for some reason, they can pick any number they want to. It doesn't have to be anything special. They can also pick maybe a 1-syllable word that they want to focus on and think about. So maybe calm or hope or patience, something along those lines. So they're basically creating a meditation for themselves, but it doesn't feel quite like meditation because they're allowed to let their thoughts wander in that situation. Whereas a lot of people feel like if they're meditating, they can't let their thoughts wander. The other things that you can do is to work through paying attention to where their breath is. And so what you kind of want them to do is to really bring their focus to, can you feel the breath entering your nose? Can you feel the breath exiting your nose? And to really focus in on just that small part. Another process that they can do for these breathing techniques, I'm giving you several here because some work for some clients and some don't. And so having several in your toolkit can be really beneficial. Another one that can be very simple and doesn't take a lot of work is that as they're inhaling, to think, I am breathing in, and as they're exhaling, to think, I am breathing out. If they bring those words into that breath work, basically what they're doing is they're kind of forcing other thoughts and memories out of their head because they're really bringing their focus to those 2 phrases. And so that can help someone who's really at a point of kind of swirling with their thoughts. You're also going to want to talk to your client a lot about kind of the self-soothing that they can do. So what can they do for themselves? What have they noticed works for them when they are feeling anxious or wound up or uptight? Maybe that's breathing techniques. Maybe it's meditation. Maybe it's prayer. Maybe it's yoga. Maybe it's talking to a friend. Maybe it's sitting in their bed with their blanket wrapped around them really tightly. All of those things are really great options for folks to think about. And to even think outside of the box a little bit for that. For some people, and we're going to talk about kind of self-care techniques in just a moment, specific to clinicians, but all of these can apply to your clients as well. But, you know, for some people, self-soothing looks like jumping up and down. For some people, it looks like maybe doing the flashes beside their eyes. And that's going to depend on what their sensory input level is. So the self-soothing is really to kind of bring their energy down, really kind of take that moment to calm themselves. And then you want to talk to them a lot about what they're doing for self-care during this time. And for a lot of folks, that may look very different from what they're used to doing, because as we know, a lot of times our trauma folks are focused on doing their self-care outside of the house, and a lot of times they're focused on doing it in the form of exercise or becoming stronger. And so being stuck at home may feel like they're losing their strength in some ways. And so really talking to them about what they can be doing at home in their own space that's going to feel like they're taking care of themselves in some way. And it may be that they have to learn some new skills during this time. So the whole idea of self-care in these strange times, I think especially for providers, is that we need to put our own oxygen mask on first. We are not going to be any use to any of our clients if, like this coffee mug in this picture, we are about to go over the edge ourselves. And so really being able to take care of yourself. One of the things that I have noticed in talking with my colleagues right now who are doing all of this work online is that for whatever reason, doing these video sessions is incredibly exhausting and tiring. I don't know why that is. I don't know if it's staring at a screen. I don't know if it's working so hard to sit still and stay steady and calm. I don't know if the anxiety levels around are just high or if it's a combination of all of those things. But as providers right now, we are also experiencing all of the same stressors that our clients are feeling, as well as taking on thanks Maria, what our clients are doing right now. So in thinking about self-care for us, we're going to be talking about 4 different categories of self-care. These are the same categories that I give to my clients. So again, using these for yourself, but also applying them to your work with the clients that you're working with right now. I break self-care down into these 4 categories just because it becomes very easy to offer that information to clients, and clients can usually remember 4 different things. So the first category of self-care that I'm thinking about is grounding and mindfulness. This can also be considered like your relaxation or Zen mode. We're talking about breathing, we're talking about mindfulness activities, yoga, restorative practices like taking baths or taking long showers if that's the place where you can go. The prayer for some folks, the end result being that you can kind of be at the end of it and kind of just right, like that's the feeling that we want to have after the end of a grounding or a mindfulness exercise. And so if the thing that you're doing, even if it's on this list, doesn't allow you to have that moment, then don't do that thing to try to relax and ground yourself, because it doesn't work for that. This is the time when folks can really start to be creative with what they're doing. Again, looking around their homes for the things that really help them for this. Research shows us that handcrafts are great for this type of activity if someone already knows how to do it. If they're trying to learn how to do it, it doesn't really work for grounding and mindfulness. But if someone already knits or crochets, reminding them that that can be very good for relaxation and help them really kind of focus on where they are. Cross stitch has not been studied, but I would imagine embroidery, sewing, those types of things have similar impacts. The other type of category that we want to look at is this idea of energy release. So if someone is very hyped up and kind of overwhelmed, just feeling like they want to explode, then we want to help them to be able to find something to let some of that energy out. So exercise can do that for some people. My teen clients love throwing things. And so throwing ice cubes at the ground to get that like shatter experience They love it. You can throw eggs at trees. Don't do that now because evidently there's an egg shortage going on because people keep hoarding it. But in regular times, again, my teenage clients love to take a carton of eggs out into the woods and throw eggs at trees. I don't know what that's about, but they love it. Um, Venting is great. So whether that's having someone that you can go to just kind of stream of consciousness, release all of these things. If you use journaling for venting specifically, just to get those things out of your head, um, talking to yourself in your home or in your bedroom, screaming into a pillow, punching a punching bag, like all of those kinds of things will work for folks. Again, dependent on what their own experience of trauma has been, they may not be able to do some of those things. And so, again, really talking to your client or yourself about what's going to work for you. Another type of self-care that we're going to want to look at is the idea of processing the emotion that's come up. So if someone's feeling depressed, if someone's feeling anxious, if someone is dealing with just all of the things in life, if you're dealing with these things, thinking about journaling as a way to actually work through the process as opposed to just getting it out of your head. Talking it through with someone, either your own therapist, a partner that you can trust, and having it be a process of actually talking through, trying to understand where that emotion is coming from. Are there changes that you can make? Those types of things. And supervision or consultation. And so all of those things can help kind of recognize what the emotion is, unpack it, put it into its own narrative form, and then decide what to do with that, or if anything can be done, because sometimes you're just going to have to figure out how to be uncomfortable. And the last category is what I often call the Control-Alt-Delete category. I talk to my clients a lot about it as your reset button. This is the chance to be able to go blank, to just allow your system to turn off for a few minutes. And so the idea behind this is that we don't want to stay in this state for extended long periods of time because then we're blocking things. But that sometimes, and you've probably noticed this at the end of a long day, at the end of a particularly difficult event, what we really need to do is just shut down for a minute. And as Stephen King would say, let the men in the basement do their work. It's allowing kind of that subconscious level of our mind process through things without us having to actively be there. So it's things like watching a really engaging TV show, getting lost in a book, playing little mindless games on your phone or device or video games. All of those kinds of things that just allow you to veg out, not have to think, not have to work through something, all of those types of things. So what I would like for you to do is to take a moment for yourself to think about how are you going to take care of you? Looking at those categories of self-care and really kind of thinking about at least one thing that you can put in each of those categories for yourself. One of the things that I often talk to clients about is that if we become too rigid with our coping strategy, that we can get stuck. And if that thing gets taken away, then we don't have a way to take care of ourselves. And so what we really want is to have 2 or 3 options in each category that are different. So if exercise is your energy release, that's great. And for the most part, you'll probably be able to exercise unless you break your leg. That might not work out so well, unless your preferred version of exercise is going to the gym. Right now, we're clearly not going to be going to the gym. So kind of taking all of that. And as you've been thinking about those things, maybe trying to implement a couple of them for yourself currently. If folks aren't being able to see the chat options coming through, folks are mentioning things like puzzles, crossword puzzles, breathing techniques, some push-ups, walking, running, reading, listening to music, having a dance party, indulging in quiet time, one of my favorites. You might not know it by this video conference, but I'm actually an introvert. There are some great online resources right now with all of the museums around the world opening up their galleries and doing virtual tours. So some of those things might be great. Hugging your pets. All right. So I know I threw a lot of information at y'all. I'm going to give you the chance to ask questions if you have any. So Maria is asking, are there breathing techniques on apps? There are several apps out there that do offer breathing techniques. Most of them offer some form of a free option. Calm is the most popular one. It's the one that my clients like the best. They have several breathing techniques on there. They have a few free options. A lot of them are paid for. Headspace is another one that has some breathing techniques on there. They also have a free versus a paid option. Both Headspace and Calm also use mindfulness, and so they have several mindfulness and meditation techniques that they offer through those apps. Right now, if you're a clinician and you have an NPI number, So social worker, LPC, psychologist, those types of things. Headspace is offering a free year of their service for clinicians. I'm not sure why they're not doing it for more folks, but it's free for clinicians right now. I also will have clients just go on YouTube and type in breathing techniques, and they found some great videos that way, as well as meditations for themselves. Those things can be tricky because people are really impacted by the voice of the person walking them through those steps. And so I always ask them to test out several to see if they can find a voice that's not annoying for them. Any other questions? This is my contact information. Email is absolutely the best way to get in touch with me. I will avoid returning the phone call as long as I possibly can because I hate talking on the phone. So email is the best. A phone call is totally fine too. Shooting me an email to be able to schedule that is the best option if you have a question you'd like to ask over the phone. 10% happier. Thank you, Muriel. That's the one that I was trying to think of, and I could not think about it. I could not come up with that name for whatever reason. That's another app that's really great for meditation. I believe there is also a book and a podcast. And as far as getting the slides, I'm going to email a copy of the handouts to Gabriella. She may be able to send out to the participants who were here today. If for some reason that doesn't work, you can shoot me an email and I will email you the slides.
Yeah, you can go ahead and send those to me and I can email them out. I can email them out to everybody that attended.
Perfect. All right, any other questions? Thank you all for attending. Gabriella, I think we're a little bit early, so hopefully you all have some rest planned for your Friday.
Yeah, we did end a little bit early, so I think we'll just give it like another 2 minutes if anybody has any questions, and then we'll go ahead and end the webinar.
Sounds good to me. I'm going to end my screen share. I think I was getting a couple of messages that I might have killed by ending my screen share. There they are. I'm awful at this. Thank you all for taking the time out of your day to attend this. I know it's an interesting time right now. What, can you explain your question a little further, Maria? I'm not quite sure I'm clear on, Maria, what you're asking as far as is there going to be something for when the COVID-19 crisis is over, as far as another presentation, or what are you thinking there? That recovering from telecounseling and the overload of video calls versus live in person would probably be a pretty good thing to do. We might need it. Being as much of an introvert as I am, I thought I would like the telecounseling and being able to work from home. And I'm finding that I actually prefer being live and face to face with people.
Same.
Yep. So it's interesting because owning my own practice, if I do go to the office, I'm the only one there. And so I can go into the office, and I've done it a couple of times, but I also feel bad leaving my husband at home with our two kids to homeschool while he also tries to work. So it's an interesting place right now.
All right, I'm gonna give it another minute and then I'm going to hit end meeting. If you're one of the attendees and you don't have anything else you want to say or any questions, you're welcome to leave the meeting as well. All right, well, thank you everybody for coming. I'll go ahead and get the presentation from Dr. Benton and I will send that out. I hope everybody has a great day and I hope to see you guys at any of our future trainings. Thank you, Dr. Benton.
Thanks, y'all. Have a great day. Stay safe out there.